Diltiazem, also known as Tiadylt Er 360 mg capsule extended-release calcium channel blockers, is a medication used to lower high blood pressure and prevent chest pain. This can help prevent strokes, heart attacks, and kidney problems. When taken regularly, it can reduce the frequency and severity of chest pain episodes from angina and improve your ability to exercise. Diltiazem works by relaxing blood vessels in the body and heart, making it easier for blood to flow, and also lowers your heart rate. These effects help the heart work less hard and lower blood pressure. It's important to take this medication as directed by your healthcare provider for the best results. When taking Tiadylt Er 360 mg capsule, extended-release calcium channel blockers, it's important to follow your doctor's instructions. Typically, it's taken once daily, either with or without food. Swallow the capsules whole, without crushing or chewing them. If you have trouble swallowing the capsule, you can carefully sprinkle its contents on a spoonful of soft, cool applesauce and swallow the mixture right away. Your doctor may adjust your dose over time, so be sure to follow their instructions. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. It's important to use this medication regularly to get the most benefit from it, and try to take it at the same time each day. Even if you feel well, continue taking the medication as prescribed. For the treatment of high blood pressure, it may take 2 to 4 weeks before you get the full benefit of this drug. It's important to take this medication regularly to prevent angina and not to use it to treat angina when it occurs. If your condition worsens or if you have any concerns, be sure to talk to your doctor. Some common side effects of Tiadylt Er 360 mg capsule extended-release calcium channel blockers include dizziness, lightheadedness, weakness, nausea, flushing, constipation, and headache. To lower the risk of dizziness and lightheadedness, it is recommended to get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, it is important to tell your doctor right away if you experience any serious side effects, such as nausea/vomiting that doesn't stop, fainting, new or worsening symptoms of heart failure, slow/irregular/pounding/fast heartbeat, mental/mood changes, unusual dreams, severe stomach/abdominal pain, dark urine, yellowing eyes/skin, or any signs of a serious allergic reaction. It is important to note that this is not a complete list of possible side effects, so it is important to contact your doctor or pharmacist if you notice any other effects. Remember to always consult your doctor for medical advice about side effects and to report any side effects to the appropriate regulatory authority in your country. Before taking Tiadylt Er 360 mg capsule, extended-release calcium channel blockers, make sure to inform your doctor or pharmacist about any allergies you have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have certain types of heart rhythm problems, liver disease, kidney disease, or heart failure. This medication may cause dizziness. Avoid alcohol or marijuana as they can worsen this effect. Do not drive or operate machinery until you can do so safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this medication, especially dizziness, constipation, or swelling ankles/feet. If you are pregnant, only use this medication if clearly needed and discuss the risks and benefits with your doctor. This medication passes into breast milk and may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. When taking Tiadylt Er 360 mg capsule extended-release calcium channel blockers, it's important to be aware of potential drug interactions that could affect how this medication works or increase your risk for serious side effects. It's important to keep a list of all the medications you use, including prescription, non-prescription, and herbal products, and share this list with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this medication include digoxin and fingolimod. Additionally, Other medications can affect the removal of diltiazem from your body, which may affect how Tiadylt Er 360 mg capsule works. Examples of these medications include azole antifungals, cimetidine, macrolide antibiotics, rifamycins, and St. John's wort. It's also important to be aware that this medication can slow down the removal of other medications from your body, which may affect how they work. Examples of affected drugs include aprepitant/fosaprepitant, asunaprevir, buspirone, colchicine, elacestrant, flibanserin, ivabradine, lomatapide, and certain benzodiazepines. Additionally, some products may contain ingredients that could raise your heart rate or blood pressure. It's important to inform your pharmacist of all the products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. If someone has taken too much of Tiadylt Er 360 mg capsule extended release calcium channel blockers and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. It's important to remember that this medication is prescribed for you and you alone, so do not share it with anyone else. Your doctor may also suggest making lifestyle changes, such as participating in stress reduction programs, regular exercise, and dietary adjustments, to help improve the effectiveness of this medication. While taking this medication, your doctor may schedule lab or medical tests to monitor your kidney and liver function, as well as your pulse, blood pressure, and EKG. It's important to attend all scheduled medical and lab appointments, so be sure to consult your doctor for more details. There are various brands and types of this medication available, and not all of them have the same effects. It's crucial to consult your doctor or pharmacist before making any changes to the brand or type of medication you are taking. Regularly monitoring your blood pressure and pulse is an important aspect of taking this medication. Your doctor may advise you on how to check your own blood pressure and pulse at home, and it's important to share the results with your doctor. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your usual time. Don't take double the dose to make up for the missed one. When it comes to storing Tiadylt Er 360 mg capsule, extended release calcium channel blockers, it's important to keep them at room temperature, away from light and moisture. Make sure to store them in a place that's not the bathroom, and always keep them out of reach of children and pets. When it comes to getting rid of this medication, it's important to not flush it down the toilet or pour it into a drain, unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.